This tutorial will cover the internal accessory organs of the male reproductive system. And those are there to nurture and transport the sperm cells. These organs include the epididymis that is found on top of the testis, and the epididymis is where the sperms that were just made in the testis are going to be stored for about 3 to 5 days. And this is where they start gaining some motion. So the sperms in the testis are immobile, meaning they do not have any motility. They get stored and mature a little bit inside of the epididymis. And then they pass through the ductus deferentia, or the ductus deferens, also known as the vas deferens, which is a tube-like structure. They're bilateral, just like the epididymis is. And then they pass on the posterior border, on the posterior wall of the urinary bladder. And that's where the sperms are going to get dumped into this shared duct known as the ejaculatory duct. From the ejaculatory duct, it will get secretions from the seminal vesicles, from the prostate gland, and these two bulbo-erythroglands. And then what is now semen, that includes the sperms and the secretions of these glands, will pass through the urethra. So all of those are considered your male internal accessory organs. Now we'll talk about them each individually. So the epididymis is found, like I said, on top of the testis. These are very narrow, tightly coiled tubes. They connect the testis to the ductus deferens, and it promotes the maturation of the sperm cells. So the sperm cells that are made in the testis, again, they are immotile, meaning they're not able of motility yet, and they have to mature. So they remain in the epididymis for 3 to 5 days, and that's where they start to become mobile. They do not reach full mobility until actually it enters into the female reproductive system. The epididymis is lined with pseudo-stratified columnar epithelium with non-motile cilia. So the cilia that are in here do not move either. Okay, they do assist, though, in the maturation process of the sperms. Now, the ductus deferens is a muscular tube made up of a lot of smooth muscles, and you can see that the majority of the tube is actually smooth muscles, while the lumen is a very narrow lumen. It does make part of the spermatic cord, and it extends from the epididymis all the way to the ejaculatory duct. The vas deferens are lined with pseudo-stratified columnar epithelia, just like the epididymis, but these do not have cilia. And all of these smooth muscles are going to contract and help in the transporting of the sperms from the epididymis into the ejaculatory duct. And this occurs when ejaculation is going to occur. Now, the seminal vesicles, also known as the seminal glands, they're bilateral. Okay, so there are 2 of these glands, and they empty their secretions into the ejaculatory duct. They are found near what is known as the base of the urinary bladder. So this is a posterior view of the bladder. The secretions out of the seminal vesicles are alkalinic. Okay, so that helps regulate the pH in the female tract. So the female tract is very acidic, and sperms need that alkalinic fluid in order to balance the acidity, the high acidity of the female reproductive tract. The seminal vesicles also produce fructose and prostaglandins. So fructose is the kind of sugar that sperms will burn in order to produce energy. So the majority of our cells use glucose to burn to make ATP, while sperms are going to burn fructose as their source of energy. So they will get that fructose from these seminal vesicles. Seminal vesicles also produce prostaglandins, which are important for the contraction of the smooth muscles, whether in the male system or in the female system. So it does help in the mobility and helping the sperm reach the egg. So all of these secretions will dump into the ejaculatory duct, And the secretions of the seminal vesicles do contribute actually the majority of the volume of semen. Now the prostate gland, it is just one gland. It surrounds the whole proximal part of the urethra. Okay, so it is kind of like pierced by the urethra. It lies underneath or inferior to the seminal vesicles and superior to these tiny glands known as the bulbo-erythroglands. The prostate gland secretes a very thin, milky, white milky alkalinic fluid, and the secretions of the prostate gland gives the very characteristic color of semen. The secretions again help in the motility of the sperms, and they do contribute to the volume of semen. Now we'll talk about something that is extremely important, and that is the enlargement of the prostate. So their enlargement of the prostate can either be benign prostatic hyperplasia or BPH, or could be due to prostate cancer. So one of the normal aging processes in males would be the enlargement of the prostate gland. And as you can see that the prostate gland surrounds the proximal part of the urethra. So when it enlarges, that leads to difficulty in urination, and it also leads to frequency in urination, meaning that they would not be able to completely empty the bladder, which means that there's always some urine that is remaining in the bladder, and that can lead to repeated urinary tract infections. So very common complaint by males, especially at the age of in the 60s and 70s, would be that they have to go to the bathroom very often, and they feel like they still need to urinate, and it needs a little bit of more of a straining process in order to fully empty the bladder. The prostate can be felt through a rectal examination. You can feel the prostate enlarged. And then taking that into consideration, we do a blood test to measure PSA or prostate specific antigen. And it is helpful in the diagnosis. PSA would be elevated in prostate cancer, but it would be of normal levels in BPH. Although that is not 100% of the cases, that is why we have to move on to the second thing, which would be a prostatic biopsy. So if you have somebody coming in with those symptoms, you do a rectal exam, the prostate is felt to be enlarged, your next step would be to do a blood test, PSA. If it comes elevated, or even if it's normal and you still want to be 100% sure, you can go ahead and do a biopsy. Okay. Treatments in the cases of prostate cancer would be the surgical removal of the gland, combined with radiation and hormonal treatments. Now moving on to the bulbo-erythroglands, which are again bilateral glands found inferior or distal to the prostate gland. They secrete a very mucus-like fluid, and that helps in the lubrication of the penis. The fluid is released in response to sexual stimulation. They're also known as Cowper's glands. Now semen is the fluid that comes out of the urethra during ejaculation. It's made out of the sperms plus all of the secretions coming out of these glands. So it includes the secretions of the seminal vesicles, the prostate gland, and the bulbo-erythroglands. They obviously contain sperms and the prostaglandins coming from the seminal vesicles. It is a little bit alkalinic, again, to regulate or to balance the acidity of the vagina. It is about 2 to 5 milliliters of semen per ejaculation. And to kind of put that into perspective, 5 milliliters is a small tablespoon. So per ejaculation, there's about 2 to 5 milliliters of semen. Each milliliter has about 120 million sperms. The sperms start the swimming process once all of these secretions are added into the mix. Now, male infertility means the inability of the sperms to fertilize an egg. And there are different causes of male infertility. One of them could be failure of the testis to descend into the scrotum. So remember when we talked about the descent of testis that happens during the late stages of fetal development? Well, if that doesn't happen, that's known as failure of testicular descent. That means that the testis is still somewhere inside either of the abdominal cavity or the pelvic cavity, meaning that the testis is exposed to higher than normal temperatures. Again, the descent of testis happens because the testicular tissue needs temperature that is lower than the normal body temperature or the core body temperature. Well, if the testis fails to descend, it means it's being exposed to those higher body temperatures, which means that on the long run, it can lead to testicular damage. It can even lead to testicular cancer. So that is one of the things that we normally do as soon as a baby boy is born. One of the routine things to check on would be, did the testes descend or did they not? And if they didn't, we would want to check on it, maybe a day later, a week later, and regularly check on it. Sometimes it takes about a month or two to descend. But after that, we would definitely want to descend it surgically. Okay, usually within the first year or two of life, just to make sure that the testes, again, the testicular tissue is not damaged, and even worse, it could lead to testicular cancer. So if the descent of testis was diagnosed 2 years later, the treatment in this condition would not be to descend it surgically. It would actually be to surgically remove the testis, a process known as orchiectomy. Other causes of female infertility would be the inflammation of the testis, for example, due to mumps. So that would be a complication of mumps. Or it could be that the testis is normal, but it's making these poor quality sperms. They either maybe have an abnormal head, abnormal acrosome. Remember, the acrosome have the enzymes that are responsible for, that help in fertilization. Or maybe the tails are unusual, that leading to the inability for these sperms to swim. Or it could be that there's a low sperm count. So the sperms are normal, but the count is very low. So very low is very relative. So less than 20 million per milliliter of ejaculated semen is considered a low sperm count. Now, CASA, or computer-aided sperm analysis, that is a technique that we use to evaluate male fertility. It not only does it analyze the sperm count, it analyzes the size of the sperm, the shape, and the motility. Now, this ends this portion. The next part will discuss the external reproductive organs in the male system.